Good morning, live from ZTN studios in Harare, Zimbabwe. Welcome to the Mint Special. Our discussion this morning, the impact of COVID-19 on education for learners with disabilities. I'm your host, Andy Hodges. This broadcast is brought to you by Zimpaper's TV network, ZTN, and our partners, the Labour and Economic Development Research Institute of Zimbabwe, LEDRIS. Now, as usual, should you have any comments or views on our show this morning, please contact us via our Facebook page, Zimpaper's TV network, or via our Twitter handle @ZTN News. Now, persons with disabilities have been disproportionately affected by the COVID-19 pandemic and the related lockdown and containment measures. Even before the COVID-19 pandemic, persons with disabilities were already vulnerable. The UNESCO Regional Office for Southern Africa conducted a rapid assessment on the impact of COVID-19 on persons with disabilities in Zimbabwe. That ran from August to November 2020, which found that persons with disabilities have experienced many challenges brought about and or worsened by the COVID-19 pandemic and the related lockdown and containment measures. Access to services such as healthcare, education, justice, and information have been severely affected by the lockdown restrictions put in place to reduce the spreading of the coronavirus. According to the 2019 Annual Education Statistics Report, there were 85,560 learners with impairments in the country. The disruption to learning in 2020 therefore meant that all these students with disabilities were ill prepared, as many of them did not have adequate study materials in accessible formats and relied on face-to-face learning in most instances. Given that most countries, including Zimbabwe, were ill-prepared for such a scenario, most learners, especially those with learning disabilities and those with auditory and visual impairments, were left behind, as most schools adopted online learning as an adaptation measure. A further area of concern was that not much consideration was made for the deaf because sign language wasn't available, and for slow learners who may need more than one lesson to grasp a concept. According to the Deaf Zimbabwe Trust, DZT, Zimbabwe does not have a sign language curriculum for deaf children. To discuss the impact of COVID-19 on education for learners with disabilities, we are joined in the studio by Masimba Kuchera. He's a disability rights activist, and Clement Nlizio. He's acting national coordinator, Education Coalition of Zimbabwe, ICOZI. And joining us telephonically, we welcome Dr. Christine Petter, Director of Disability Affairs in Zimbabwe's Ministry of Labour and Social Welfare. Ladies and gentlemen, welcome to the Mint Special.
Thank you.
Thank you.
Dr. Petter, let me start with you. On June the 9th, President E.D. Mnangagwa launched a national disability policy. What are some of the highlights relating to the delivery of education to learners with disabilities that are contained in that policy?
Thank you, Andy. We are very excited about the launch of the National Disability Policy by His Excellency, the President of the Republic of Zimbabwe. And in this policy, there is a section 3.9, that is dedicated to the subject of education. And one of the key elements of this section is that all persons with disabilities must be exempted from paying fees and levies at all public learning institutions. Because you find that a lot of children with disabilities, some of them have not been able to access education because it's offered it can be expensive or parents cannot afford. So the policy is directing exemption of fees at all learning institutions. And another thing that is so interesting about the education section is that the policy is also directing that on the basis of merit, persons with disabilities should be awarded a minimum of 15% of scholarships, including on the presidential scholarship program. That provision ensures that persons with disabilities are not marginalized in scholarship programs. Another thing also, Andy, is the National Disability Policy is directing that the subject of disability should be ingrained as an examinable subject in the curriculum of all learners from early childhood education to tertiary levels. I think that's very significant because you find that there's a lot of marginalization or mocking of learners with disabilities. We are calling for inclusive education, But do our children know what disability is all about? Have we taught them to embrace difference, bodily difference? So the policy is directing, once disability is taught in schools from early childhood, children learn about disability from an early age, and that reduces the marginalization and stigmatization of children, of learners with disability.
Thanks, Dr. Peter. Masimba, let me bring you in here. You heard Dr. Peter there about some of the issues raised in the National Disability Policy as it relates to learners with disabilities. She talked about merit, 15% scholarship, learners with disabilities exempted from paying fees, and of course ingraining it as an examinable student, teaching our children exactly what it means. But so you can comment on that, but I also want your opinion. Do you think that learners with disabilities have adequate support from both the Ministry of Education and from the Department of Disability Affairs?
Thanks very much. Let me comment on what Dr. Peter has said. And I'm interested in the last thing she said, where disability should be taught in schools from ECD, which is early childhood development, to tertiary institutions. I think this could be a game changer when you then are able to look at disability and also to understand disability. One of the challenges that we've had is that we've had different interpretations of disability depending on the time that you grew up. And this has made it difficult for people with disabilities, as I segue into your question, to get adequate support in some instances. So I think the framework and infrastructure for support is available. So if you go to the ministry, if you go to the Disability Affairs Department, the infrastructure and the frameworks are there. But what you then have is the human resource which is supposed to dispense that support sometimes is lacking. And it's lacking in a variety of ways. One, I think that issue of not fully understanding and embracing disability as it should be. But also you have challenges when you talk about people who are deaf, that some of the human resource element within these departments are not able to speak sign language. So hopefully what training people from early childhood to tertiary institutions will do is it will bridge that gap between the understanding of disability and practically then dispensing the support that we hear is there in these ministries. So basically what I'm saying is that on paper, at the ministry offices and in policy documents, support is supposed to be available in terms of adequacy. Some of it could be resource constraints. But then practically speaking, you have a lot of colleagues, you have a lot of friends who then come and say, we were not able to get the support that is there. And there's also a lack of awareness in terms of what's readily available. So when you then go to a department and you request for certain support, be it in terms of acquisition of assistive gadgets or support in terms of school fee payments for now, before the policy kicks in, you may be turned away if you are not aware of the fact that that support could be available for you.
Clements, you know, you heard there what Dr. Peter said about some of the issues covered in the National Disability Policy as it relates to learners with disabilities. And of course, you've heard Masimba there quite eloquently state that you may have specific policy responses, but implementation or action is lacking on the ground. So it's an interesting thing, because the policy obviously is for good and bad times. But my question to you is, what specific policy measures do you think that the government has put in place to mitigate the impact of COVID-19 on learners with disabilities?
I think before I get there, Andy, I want to say our problem in Zimbabwe is not the lack of policy, as you have heard that Masimba and Dr. Peter there expressing that the policy is existing. But our challenge mainly comes when it comes to the issues of implementation. On COVID-19, the Minister of Primary and Secondary Education, like anybody else, was caught unaware. We were ahead of everyone, as expressed in Section 75 and Section 723 of the Constitution. The procedures and manuals of how to conduct, lessons during COVID-19. You have the issues to do with providing wash in schools. You have issues to do with lessons. If you look at the list, we're then launched. The television were launched this year.
But you also have an issue there, don't you? I mean, you have radio lessons, but then, of course, you have learners with deaf disabilities, for example.
Not able to access the radio lessons. But then, because COVID started hitting us in 2019, and we're then learning all this time. And it's a resource challenge. It's a resource challenge. Everything points to education financing. We do not have the adequate resources to finance our education and to make sure that everyone do access education as provided by the Constitution.
Dr. Peter, you heard Clements there talking about a resource issue, and in fact we don't have the resources to support everybody in terms of effective learning. I mean, how do you think that your own department or the government has been able to support learners with disabilities during the pandemic?
What I see, of course, I would say, Andy, thank you. There is the BEAM program, which is the mainstream program. But this COVID-19 pandemic caught us unawares. But it also became a point of learning for us, where we see that there is need for close collaboration between the Department of Disability Affairs in the Ministry of Public Service, Labour and Social Welfare and the ministries responsible for education, and also the ministry responsible, the local government ministry, which is also responsible for disaster risk management, responding to these issues. Because we then need to together reflect on, we need to address issues of preparedness. How do we prepare for disasters? Response, how do we respond? Recovery, and recovery and reconstruction. When a pandemic strikes or when a cyclone strikes, are we prepared for that? And we need to think about these things before they happen and take a multi-stakeholder approach whereby the Department of Disability Affairs brings in the expertise with regards to disability, the Education Ministry, the expertise with regards to education, and the Ministry of Local Government, the expertise in relation to responding to disasters and pandemics. And I think that collaboration will give us a solid base whereby we can then move. I've noted what Masimba has said about very good policies, but then with this practical multi-stakeholder collaboration, we are then able to move the provisions of the National Disability Policy from paper to the real world to make a difference in the lives of persons with disabilities, including learners with disabilities.
Right. Yeah, you're right. The implementation is critical, isn't it? I mean, you're right. Having great policies is good, but implementation is the key. Clements, let me take you to a different issue here. The inclusivity of the education policy framework and its adaptability to the times that we currently find ourselves in. Your comment?
Yeah, I think in terms of the policy framework, it's inclusive enough. But maybe before I go to the second part, let me point out that in some of the policies there is a certain language that I have found within the policy that is a bit disturbing. You find that if you look at the Education Amendment Act, Section 68B, which talks about issues to do with the learners with disabilities, it says a school should endeavor to make sure that you see, and it provides a provision whereby it's subject to availability of funds, which is quite disturbing for us, because what happens when a school does not have funds?
They don't prioritize.
Yeah, so they don't prioritize. So that's such languages within policy frameworks. It's quite disturbing. But in terms of adapting to the current times, like I said earlier on, to say we were caught unaware. We were very much caught unaware. Like, the Minister of Primary and Secondary Education had no policy to deal with the disasters.
We were caught unaware, but did we react quickly enough? I think that's another question as well, isn't it?
We tried to react quickly, but for you to react quickly, Andy, you need resources. And it goes back to resources. We try to react quickly, but I can hear, the Minister of Primary Education made it clear. We were planning together with the coalition and many other stakeholders. And when it comes to putting up these radio lessons, to putting up these online lessons, to putting up these television lessons, they challenge them in finances to say, how do we finance it? How do we finance the teachers that are going to prepare the lessons? How would we finance, the airing itself? It was a challenge, and both stakeholders and the ministry struggled to raise funds. And these little funds that we raised were not inclusive.
Couldn't cover the whole thing, of course. Yeah, because it wasn't just learners with disabilities.
So it was a disaster which we are not prepared for. And again, our reaction, if you see now the time that is there, we should have reacted. But again, it's an issue. We do not have enough.
I mean, we obviously don't wish another disaster or pandemic to come, but I hope that we have learned our lessons from what's happened.
The pandemic is still ongoing, and we are still facing the same challenge that we had in 2020. Instead of learning from and fixing, we are still learning the same challenges right now. Opening of schools is extended for the next 2 weeks, which means it's going to be a pressure on the teachers, it's going to be pressure on the learners.
Right, you're watching the Mint Special, our discussion this morning, the impact of COVID-19 on education for learners with disabilities. This broadcast is brought to you by Zim Papers TV Network, ZTN, and our partners, the Labour and Economic Development Research Institute of Zimbabwe, LEDRIS. Masimba, I'm going to ask you a two-pronged question. The first one, of course, is your comment on the inclusiveness of the education policy framework and if it's adaptable to the times that we currently find ourselves in. But the second one is that, you are someone who has gone through the education system. What are some of your experiences, and would they compare to what younger learners are experiencing today? Have things actually changed?
Well, interesting questions, Andy, but can I just make a comment? I am a bit afraid of how my friend Clemens is raising the issue of resources as the only stumbling block to the kind of perfect reaction that we could have made. I understand the value of resources in everything that we need to do, but were we talking to each other enough? So when you look at it from my own point of view, did we really need television lessons to include deaf children? When you look at the coverage of television, where do we get television coverage? So was it the best outlet to give education to students who are deaf, for instance? So I think that...
so you're talking here about the means of education. How do you get that education to people outside of urban areas?
When we look at it, I mean, resources shouldn't be the be-all and end-all of things. I mean, are we talking to each other enough? Do we have lines of communication to the Department of Disability Affairs, for instance, to make a suggestion to the Minister of Education, for instance, to make a suggestion? There could be ways in which lessons can be packaged and sent to students in a way that is resource efficient for the little resources that we had. Did we have to go big on television when television doesn't cover even 80% of the whole of the country? So for me, the question has to be, when we do the planning, are we planning together? And when I say are we planning together, it's not only looking at government. Are we planning together as a nation? Does government give us the opportunity to be able to talk to them? So I go to Dr. Peter. Dr. Peter, in as much as this is how you are looking at things, I suggest that we do this and this and this and this. Do we have those lines of communications? How clear are they, and how can we access the Education Coalition, for instance? Because I think that from design, if we design the response poorly, the outcome will surely be poor. So when you then go to issues for me in terms of packaging lessons, it still can be done differently with less resources.
Nice.
If then you bring people who are then the learners to be able to find out also how they think and how best you can. So when you look at even online lessons, when you do surveys and look at families of people with disabilities, how many of them have those gadgets, and how many of them can afford data? You then go into a different ball game altogether. It may need a new mint special. Let me
we'll need a whole new program.
Yeah,
okay, but very briefly then, I mean,
you've
been in the education system. You went through this as a learner with disabilities. What's changed? Have things actually changed from your time at school?
Well, I think things have changed. There is more integration, for instance. We don't have now only schools for people with disabilities. I went to one, I went to St. Giles, and I went to Kapota. I ended up at Prince Edward, which was more an integrated school, but we now have a lot of integrated schools. And from what Dr.
Is that
Peter
countrywide though? Is that very specific?
From what Dr. Peter is saying, this is the direction we are going.
Okay.
I think that's a good direction. And so if everyone learns what disability is, then integration will be easier. So, and I think that will be good for students, because students with disabilities sometimes, when they live in their own small space, adapting to the whole new bigger world could be difficult. And in the same vein, for people, when they then meet someone without a disability, either on the road or well, later on in life, they may have difficulties in understanding disability. So for me, integration is the way to go, right. And I think that has changed for the better.
Okay. Dr. Peter, I want to bring you in here because Masimba made a very good comment there about lines of communication and are we actually talking to each other? That's the first part of my question. And related to that, how does your department relate to the Ministry of Education when it comes to learners with disabilities?
Thank you. I will make reference to this National Disability Policy, also recently launched, as we have said, by His Excellency. The policy itself, when you look at it, it's calling for closer collaboration between government ministries, different stakeholders. So we're at that point where we are developing lines of closer collaboration with the ministries responsible for education, because we realize that on our own, we can't do it on our own. There needs to be closer collaboration. For example, I'm aware that the Ministry of Primary and Secondary Education is developing an inclusive education policy, which has also been shared with our department, and it gives us an opportunity now to give input. But I would like to say closer collaboration is required.
Right. Thank you.
I just want also to say, commenting on what Masimba said, we spoke about learners, but I also want to say the policy is also making reference and underscoring the importance of ensuring that there are educators with disabilities. 15% of student teachers have to be persons with disabilities. Because once we begin to train persons with disabilities to also become educators, and they have a presence in the learning institutions, it's also going to help a lot to achieve inclusion and also ensure that learners with disabilities get appropriate education.
Right. Clements, you know, we've talked here about what we could re-examine, what we could do better, what we could implement better, but surely there must be some successes that Zimbabwe has achieved for learners with disabilities. In your opinion, have we had any of those?
Yeah, successes, yeah. Of course, going back to his argument to say TV lessons, but for us, it was a success for us to be able to launch the television lessons to make sure that, you know, all learners with disabilities access education. And also, the Minister of Primary and Secondary Education has been, you know, handing out, you know, handouts, physical handouts for learners with disabilities, and for all learners to make sure that you know, they do learn during the pandemic. So those are some of the successes that have been registered. There might be few, but those are the key successes, because, you know, some of them managed to sit for their examinations and so forth. Of course, challenges are many, but there are little those success stories.
Dr. Peter, I'm going to ask you two questions, and then I'm going to bring. I'm actually deliberately making Masimba come in last so he can comment on it. The first one is about assistive devices used by learners with disabilities. For example, braille machines and hearing aids, which most of them are imported. Has the government been able to assist learners with disabilities procure these essential items?
Thank you, Andy. In the Ministry of Public Service, Labour and Social Welfare, we do offer support in terms of acquiring assistive devices for persons with disabilities, including learners with disabilities. But we have noted that importing these assistive devices is also very expensive. So the National Disability Policy is directing institutions of learning, higher learning, tertiary institutions, for example, to ensure that we establish hubs that manufacture assistive devices locally and in industry as well, so that they become more accessible and affordable to enhance the well-being of persons with disabilities and learners with disabilities. I also take this opportunity to advise that yesterday we were at the University of Zimbabwe at the Innovation Hub, and we were very impressed to learn that the Innovation Hub has come up with a walking stick for blind persons, including blind learners, which they can use to move from place to place, and also mapping of pharmacies. They have come up with an application on the internet which helps to know where is the pharmacy, I want this drug, how can I find it, and also tricycles. We think that is groundbreaking to see our own University of Zimbabwe, the Innovation Hub, coming up with these assistive devices, and this initiative, we do believe that replicated in other innovation hubs in other universities and in industry is going to have a great impact, because then assistive devices become locally available.
So, Dr. Petter, obviously we're all hoping that the COVID-19 pandemic eventually goes away and we get back to normal, and obviously children go back to school. So that takes me to my next question for you. Infrastructure at schools. What are some of the infrastructure gaps in ensuring that learners with disabilities aren't left behind when lessons are finally delivered or schools are finally open?
Thanks, Andy. We are calling for reasonable accommodation, where both in terms of access to not only the physical environment, but also to communication and information, and coming up with plans of learning, because you see, when we say learners with disabilities, they are not all the same. They have different kinds of disabilities. How do we ensure access by learners with physical disabilities? They need ramps, for example, to access classrooms in certain buildings and ablution facilities. How do we ensure access to information, to learning information by learners who are deaf or learners who are blind?
Nice.
So all those issues we are looking at, and coming up with more. There's a lot of awareness raising as well as capacity building that is required, because sometimes we may direct people to do things which they don't understand. So we are also coming up with a plan of how then do we make duty bearers in particular institutions understand what providing reasonable accommodation for learners with disabilities means in a practical sense.
Right. This is Masimba. This is why I brought you in at the end here after that, because I need your comments, please, on the access to assistive devices and also the infrastructure gaps that, in your opinion, need to be addressed. And also, furthermore, what are parents' concerns regarding the learning environment for their children?
Thanks very much, Andy. When you look at assistive devices, I think this is a key for learners with disabilities. If I do not have Braille or a laptop, it's going to be very difficult for me to access education.
Exactly.
So those assistive devices are sort of constitute probably 40% of how I can successfully access education. So it's key that we have assistive devices. And there was a news item on what Dr. Petter was talking about in terms of the Innovation Hub. The next stage and step for us is to map out how we can bring this to market. Perhaps then by looking at how many institutions we have and how many assistive devices we may have, so that we move it from innovation to actually something that we can,
practicalities, if I can call
that
it
we can market and sell and I'm sure they...
At an affordable price,
Yeah.
of course.
So when you look at assistive devices, that's key. Then infrastructure is also a big one. It's a big one in the sense that when you look at infrastructure and when you look at schools, infrastructure makes people with disabilities either go to school or not go to school. So if I have albinism and I'm learning in the sun, I'm likely not going to be going to school if I don't have sufficient sunscreen lotion. So when you talk about assistive devices, we are not only thinking of gadgets, we are also even thinking of things like sunscreen lotion for students with albinism, if they are going to be learning in the open, for instance. So when we look at infrastructure, I think it's key what Dr. Peter says about then raising awareness and training duty bearers. But I want to also just raise a challenge to Dr. Peter to say, I hear the plan to have closer collaboration interministerially and interdepartmentally. I hope it also spills across to those who are not in government like us, who still also have ideas. My belief is that we are all aiming for ensuring that learners with disabilities or people with disabilities get a better life. And government is the primarily responsible for ensuring that happens. But we also need to understand that we have people who then may not necessarily be part of government, but who also want to contribute. So I hope as we get closer collaboration interministerially and interdepartmentally. So,
Masimba, are you saying then that collaboration between government and outside stakeholders is lacking at the moment, in your opinion?
I'm saying that as we move towards closer collaboration within government, we also have to move towards closer collaboration across as well, so that we can have those lines of communication that I was talking about. So in terms of would it be lacking, I don't think it's lacking. It is there, but can more be done to be able to integrate those lines of communication between say organizations of people with disabilities or people with disabilities? If I have ideas, how do I share them with the department, for instance, so that when the department then goes to their interministerial discussions, they can also be able to look at some of these suggestions that come from the outside.
Dr. Peter, I can ask you to briefly comment on that. To strengthen and enhance those collaboration and getting ideas from outside government that enhances your policy framework, enhances your implementation of your policy. Your comment to that?
Thank you, Andy. Like what Masimba said, that is very important. And as government, we are working hard to ensure the meaningful participation of various stakeholders, including the private sector, and particularly, and most important, persons with disabilities themselves and their representative organizations. We do argue that persons with disabilities are the masters of their own experiences.
Yeah, so they should have the most input into what you're going to do. It makes sense, doesn't it?
It does, because we also uphold and respect the mantra of the disability movement of nothing about us without us.
Okay. You're watching the Mint Special. You weren't going to go there, right? That's what we said. We can. I think we may need another program on this. You're watching the Mint Special. Our discussion this morning: the impact of COVID-19 on education for learners with disabilities. This broadcast is brought to you by Zim Papers TV Network, ZTN, and our partners, the Labour and Economic Development Research Institute of Zimbabwe, LEDRIS. As usual, should you have any comments or views on this very topical and important topic today, please contact us via our Facebook page, Zim Papers TV Network, or via our Twitter handle @ZTN. News. Masimba, this is the section I always like to talk about recommendations. I mean, the impact of COVID-19 could possibly could actually benefit the education system if we use it correctly or if we learn the lessons correctly. What are your recommendations? What do you think should be done to assist learners with disabilities learn better, access education better, be able to access the infrastructure better, etc.? Your recommendations. I know it's probably a long answer, but I can't give you that much time, unfortunately.
Okay, so first of all, I think there is need for us to be able to be talking together. What that means is that those who are designing policies and those who are meant to be beneficiaries of that policy should be part of the design of the policy. So one of the positives is that we can then be able to freely share ideas with each other. We can be at a table like this or at a program like this or in other platforms being able to share ideas. That's the first thing. The second thing is that we need the universal design approach, and that will ensure that no one is left behind, right? So the universal design approach basically talks about ensuring that you have policies, infrastructure that is suitable for as many people as is possible. And we can't have enclaves anymore, infrastructure or information that's inaccessible, because we have seen where it has gotten us. The reason why we were ill prepared for COVID, ill prepared for cyclone, is that we were not universally designing our things, and that's why we are where we are. So adaptability of policy, adaptability of infrastructure was more difficult during COVID because we didn't build infrastructure, we didn't build policies with as many people in mind. These could be my recommendations in a very thick nutshell.
Thank you. Clement, let me come to you. You yourself, I mean, you live and breathe education. I mean, let's be clear about this. Do you have specific recommendations that you would give to both the Ministry of Education and Dr. Petter there, to the Department of Disability Affairs? I mean, what do you believe they can do better or should do better in relation to learners with disabilities?
You know, mine goes to the entire government and the entire nation. I've been involved, in this. Of course, I agree with the need for greater integration and coordination. But to me, what is key, I know Masimba would argue otherwise, but what is key for me is to increase the cake when it comes to education financing. Resources. Everything hinges upon resources. If you go to schools now, the ramps that we are talking about and so forth, I've been going around monitoring schools. Schools, they have got all the policy documents, they've got all the circulars from the PS, from the minister to say you have to put ramps. But the key issue within schools are resources.
They don't have the money.
They don't have the money. And if you find education resourcing in this country is depending on households, and the households are struggling. So for me, let's work to make sure that we increase the financing of education in this country.
Because you're saying that there's a fine balance, isn't it? The financing of education and all the wishes that we need to put so that learners with education, learners with disabilities can learn. Dr. Petter, you have the final word. What is the way forward? What is your department, together with the Ministry of Education, going to do to improve the learning environment for learners with disabilities?
Thank you, Andy. My final word is we are going to be talking to each other more, and we are going to be working in closer collaboration to strengthen our capacity to ensure that learners with disabilities have meaningful access to education.
Thank you. Masimba, I am going to bring you in here. I did say Dr. Petter had the final word, but I think I should give this to you. It's a very interesting discussion, because you have a year and a half of learners not being educated. They have to catch up, I suppose, in the next 6 months, if I'm not mistaken, a year and a half worth of education. I mean, this is a difficult task, particularly if you take into account the lack of facilities or the lack of access to education with learners with disabilities. Your comment to that?
Well, I think what Dr. Petter said about reasonable accommodation is key here. To also ensure that we probably have a blended curriculum probably for the next couple of years, to ensure that students, especially learners with disabilities, are able to catch up, because they have been now left behind not only because of COVID, but also because they were not able to access online lessons when we thought we were moving forward.
Right. Thank you. We have come to the end of our program today, and I think on that note we will end it there. You've been watching the Mint Special, our discussion this morning, the impact of COVID-19 on education for learners with disabilities. This broadcast was brought to you by Zim Papers, TV Network, ZTN, and our partners, the Labour and Economic Development Research Institute of Zimbabwe, LEDRIS. I'd like to thank our guests today, Masimba Kuchera, disability rights activist, Clement Lizio, Acting National Coordinator, Education Coalition of Zimbabwe, ECOZI, and Dr. Christian Petter, Director of Disability Affairs in Zimbabwe's Ministry of Labour and Social Welfare. Ladies and gentlemen, thank you so much for appearing on the Mint Special.
Thank you very much.
A final comment. It is clear that prior to the COVID-19 pandemic, there already existed gaps for learners with disabilities, both in how they were taught and the necessary infrastructure to teach them effectively. Given these pre-existing gaps, home learning for children with disabilities brought unprecedented challenges, with the majority of them failing to enjoy the right to education. A qualitative study conducted by Deaf Zimbabwe Trust on the capacity of parents of children with disability to provide a learning environment in the home for their children with disabilities revealed that most parents and guardians of children with disabilities were not able to provide learning support in the home due to their own inability of parents and guardians to use sign language and communicate learning materials with their deaf children, including assistive devices and specialized teaching approaches. In fact, the literacy levels among some of the parents and guardians also inhibited them to effectively teach their children. And unconducive and at times crowded home environments for most children did not provide conducive spaces to enable deaf children to study. In Zimbabwe, greater effort must be made to improve how and through what means we teach learners with disabilities and the support we give their parents. This will ensure we leave, as Masimba said, we leave no one behind. I'm Andy Hodges. Goodbye, and please, you all be safe.
Thank you.